Hey everybody, this is Dr. Clark Schierle with Northwestern Specialists in Plastic Surgery, here with 5 things that you may not know about the mommy makeover. Now, what is the mommy makeover? First of all, the mommy makeover refers commonly to some sort of breast procedure or some kind of tummy procedure, which is designed to help women who have had children with issues that arise after weight gain, weight loss, pregnancy, childbirth, breastfeeding, so forth. This is not to imply that there's anything wrong with moms or their bodies. Stretch marks are not evil. Our patients come to us to help them with these issues because they do bother them and they affect their self-esteem or their confidence. And we feel like moms deserve to feel as beautiful as we know they are within. These are issues that are easily and safely corrected with many of the surgeries that we offer. And that's why we do feel good about helping moms with these various issues. In addition, the mommy makeover can refer to a number of other procedures that can be done at the same time safely. I've done rhinoplasty, facelifts, neck lifts, labiaplasty, you name it. There's lots of surgeries that can be combined safely by a board-certified plastic surgeon with experience in these areas. Let's get into it. So number 1, most patients can actually avoid a breast lift. What does that mean? Well, a breast lift involves removing extra skin from the breast to tighten and give it a more lifted, perky appearance. For most moms, after they've undergone the process of weight gain, weight loss, pregnancy, childbirth, and nursing, the breasts may take on a little bit of a deflated appearance where there's a skin excess in relation to the breast volume. What does this mean? You can think of it simply in one of 2 ways. There's either not enough stuff to fill up the skin that you have, or you have too much skin to hold the stuff that you have. And so you can address this by either performing a breast lift, which keeps you more or less the same size, creates scarring around the areola typically, and then sometimes going vertically down as well as horizontally in either a J, an L, or an inverted T pattern. This allows tightening of the skin envelope, but does not affect the volume of the breast that much. You can also address it the other way, which is by adding volume to the breast. And this is most commonly achieved with a breast implant, although you can also do it with your fat or other options. By performing a breast implant, the volume is increased, and this helps to take up some of that extra skin. Depending on the considerations and your particular anatomy, you may be able to avoid the scarring associated with a breast lift. So this is something to discuss with your board-certified aesthetic plastic surgeon during your consultation. But many patients are really relieved to know that they can avoid the scarring associated with a breast lift. Next, you can actually avoid all scarring on the breast altogether if you perform a breast augmentation done through the transaxillary or armpit approach. This is something that we specialize in here at Northwestern Specialists in Plastic Surgery. We just completed authoring one of our many book chapters on the subject, and it's something that we often will teach to our fellow plastic surgeons at national meetings around the country. By going through the armpit, we are able to place the implant in the same pocket. We perform the same surgery, but it's done from the top down instead of the bottom up through the traditional inframammary or under the breast approach. This allows you to avoid any scarring on the breast. Many people will argue that the scar under the breast is pretty well tolerated, and in general, it does heal very nicely, and it is. It's not typically a scar that you as the patient are gonna see, but it is a scar that may be visible during certain intimate situations in which you're laying down and someone, such as a partner, will be looking up at the breast from below. So we do find that it's important to offer the option to our patients so that they can take that into consideration as they weigh their different choices. The number 3 thing that many of our patients didn't know about the mommy makeover is that they're often able to avoid a tummy tuck and can get by with liposuction alone. So we here at NSPS are proud practitioners of safe lipo techniques, which we feel are some of the most advanced liposuction techniques available currently. And these techniques allow some stimulation of skin tightening in addition to the fat removal, so that many of our patients who feel like they do have a little bit of extra weight around their waistline are able to achieve their results with safe lipo alone without the added scarring of a tummy tuck. The liposuction procedure is going to be a lot less expensive, a lot less recovery, a lot less downtime, a lot less discomfort associated with the muscle tightening associated with the tummy tuck. And so this is something to discuss with your plastic surgeon if they're versed in these more advanced liposuction techniques that really do help to optimize contour irregularities as well as optimize skin tightening. Number 4, is it safe to do all these surgeries all at once? Studies do show that surgical safety, surgical complications do seem to become a little bit more challenging after about the 5-hour mark for overall surgical procedures. So we here at NSPS often will perform 2 or 3 procedures during the same surgery, as long as we're able to get them done in a safe, efficient manner and optimize the patient's recovery. This is a great convenience to many of our moms who don't have a lot of extra time for themselves, as we all know. This allows you to recover once and achieve an improvement in multiple areas of your body. It's important to assess your overall health, how challenging the procedures are on their own. We wouldn't want to do one of the largest, most challenging breast reduction surgeries that we've ever done in conjunction with one of the largest, most challenging abdominoplasties we've ever done, because this might start to lead into longer times that we wouldn't feel as good about. But it is possible for the majority of patients to achieve improvement in multiple areas at once with one operation and have one recovery, one downtime, and truly achieve a long-lasting natural transformation that allows them to get back on track as quickly as possible. Number 5 is the concern that many people have that they're going to have a lot of surgical drains, and they've heard that drains are a big hassle after their surgery. Well, drains have really been all but eliminated in a majority of aesthetic surgery that we perform. Drains are not indicated in breast reduction. We don't use drains in breast reduction. In breast lift or breast implants, they're also not typically used. We've also eliminated drains from the majority of our tummy tucks, performing the so-called no-drain abdominoplasty. Modern techniques that involve quilting sutures as well as progressive tension sutures allow us to eliminate the space that's created during the abdominoplasty and minimize healing complications as well as fluid buildup in a way that allows patients to avoid the hassle of having drains. And so this is something that's also very important for you to realize. If you'll notice a common theme between all 5 of these things that you may not know, a lot of them do center around issues concerns about excess scarring, excess downtime, or excess issues with the recovery, including drains and hassles of that sort. It's important for you to know that we're always evolving our techniques, we're always improving our techniques, and the mommy makeover that we perform today is much different than what we did even a year or 2 ago. We're always lecturing and attending national meetings, learning from our peers, and trying to give you the best results with the least downtime possible. As we all get busier and busier in this society, we feel like these are really important goals for our patients, and we share those goals with you. Hopefully that was useful to you. If you have any thoughts, questions, comments, concerns, if there's anything else that you'd like to hear about, either with this video or in future videos, please leave a comment below. Make sure to subscribe and click that little bell to be notified when new videos post, and take care.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.